Amid the COVID-19 pandemic, so many of us sought to be socially distant, had questions about the virus, unsure of what it would hold for tomorrow. But there's another group of individuals, our healthcare heroes, who rushed to the front lines to serve their community and to combat the virus. Amy Shanahan is one of those, and tonight she'll sit down with us to talk about the why. All of that is coming up right here, right now. I'm Sam Chen, and this is Face the Issues. Good evening and welcome to Face the Issues. I'm Sam Chen. Amid the COVID-19 pandemic, so many of us sought to be socially distant, and we were worried about what the future might hold. Most of us still are. But there's another group of individuals who, despite the pandemic, decided to rush to the front lines of the pandemic. They served our communities, they rolled up their sleeves to combat the virus. They are, of course, our healthcare heroes. And while I wish on this show we could interview all of them across our area and across the nation, we are pleased tonight to introduce one of those healthcare heroes, Amy Shanahan, who's a registered nurse based at the Lehigh Valley Health Network. But as we'll find out tonight, she's also been volunteering her time and her efforts elsewhere. Amy, welcome to Face the Issues. Thank you so much for being here.
Hey, Sam. Thank you so much for having me. It's great to be here.
It is a pleasure to have you here. And before we even get started, let me just start by saying thank you for what you do throughout these last few months. I know it's been a crazy time for everyone, but even more so for people like you who have been in the medical field and been on the front lines of this. So the first thing I want to ask you is, how are you doing? And I'm hoping that you are well and staying healthy.
Well, thank you for saying that, first of all. I have been healthy the whole time. Got tested and I'm negative and have been perfectly healthy. I'm doing well. I mean, there's a lot that came with going and taking care of people during the pandemic, and I was strictly working with COVID patients. So there was a lot to it, but overall I'm doing well.
That's good to hear, and we will continue to pray that that's the case. Amy, let me start by just kind of getting to know you a little bit better and letting our viewers know you a little bit better. If I understand correctly, you are from the Lehigh Valley originally, right? Can you just tell us a little bit about you and whether it's growing up here or interest of yours? If someone is to meet you, what would they want? What would you want them to know about you?
Oh, wow. That's a good one. Yeah, so, I mean, I was from here. I went to college, central Pennsylvania. I started working at St. Luke's. I was a mental health tech, and I just loved the hospital setting. And so I ended up going back to nursing school. And as far as what I think I would like people to know about me is that, I love to work. I love to help people, work with people, and just, it's in my heart to just want to be good to people. So yeah.
Along those, and that's a wonderful example, I think. And along those lines, Amy, at what point did you realize that you wanted to do this in the medical field? Or has this always been a childhood dream, or is this something that you a passion you developed later in life?
No, it was definitely later in life. I never thought about being a nurse, really. And then I worked at, like I said, I worked as a mental health tech, and I would get floated out to different medical units. And I loved being on the floor and watching the way that people work together and the teams work together to take care of people, and just seeing the process of what nursing was. I was like, that is awesome. I want to do that. And so that got me started. And then I went to nursing school, got my first job in an ICU, and have been doing nursing. I've done a couple different kinds ever since then, but that's how I first got started.
And what's that process like? I mean, so you go to college and then you start working as a mental health tech. You find this passion and desire for you to go into nursing. What is that process like going back? I mean, how long does it take? How rigorous is it and with your training and education?
So it was a 16-month program, actually. Since I had a degree originally, sure. I could go back and just do the nursing the nursing classes that I needed to do to be able to get my degree. And from there, it really was like just orienting on the floor, on the units and like learning, like you do the classroom learning and then you go and do the in-person training.
And Amy, for most people, we know who nurses are. We probably all know nurses, in our lives, and we kind of have some idea of what they do. But I don't think we fully understand what a day in the life of a nurse is like. So before the COVID-19 pandemic, because I imagine things are slightly different now than they were 3 months ago. So before all this happened, what was an average day like in the life of Amy Shanahan?
An average work day or an average day?
Let's go with the average work day.
Okay. So I work primarily in a burn unit. So, you get in and you get to know your patients. You're getting report from the night shift nurse and learning your patients, going through their chart and making sure that you have a pretty good picture of who they are and what their needs are. And then going to meet with them and seeing what their actual needs are that they're telling you. And then as far as working on the burn units, we're doing a lot of dressing changes and working with like a lot of the patients and their families. And, it depends on the day, but sometimes you'll have one patient, two patients, up to like 4 or 5 sometimes. And again, you're just kind of like communicating with them all day long, making sure their needs are met, making sure that you're giving them the best care. And so, the burn world is a little bit different than a regular ICU, but, you're checking them every hour to make sure that, like I said, all their needs are met.
Mm-hmm. And what's the work? I mean, we hear a lot of times with doctors, PAs, MAs, nurses, that this is not a 9 to 5 job, Monday through Friday. What's the work week like for you schedule-wise?
So usually I do 3 days a week and then 3 12-hour shifts a week.
Oh, wow.
And then you have the rest of your week to yourself. But yeah, that's usually 3 days a week.
And how intense are those 3 days? I mean, a 12-hour shift, and you're on your feet virtually the whole time. That seems like a super intense, concentrated time of work.
It's funny. Sometimes I think, I'm just very used to it at this point. Sometimes I think, what would it be like to work a regular 9 to 5 job? But even your flexibility to be able to put your days together or spread them apart. I love a 12-hour shift.
Does it tire you out? I mean, when you come back at night, do you feel like this is just, is there ever a point in it where you think, I can't believe I'm doing 12-hour shifts?
Not really the 12-hour shift. I mean, I'm exhausted. Don't get me wrong. By the end of the day, by the end of a couple day stretch, I'm like, ready to lay down and not get up for a day. But the 12-hour shift itself is not too bad.
Well, that's good to hear. Well, we certainly appreciate people like you who do that. Amy, let me ask you this, pivoting to the last 3 months now with the COVID-19 pandemic, how has, and we'll get to your volunteer work in New Jersey in the moment here, but how has the average work day for you changed once the COVID-19 pandemic hit?
Wow. It's like a completely different ball game, completely. Because you don't have a lot of time to really plan your day. You walking into patients who are so sick, you have a heavy patient load, like heavy patient assignment, and you have to be paying attention to the monitors and the screens, the numbers. So you're not planning your day. Your patient's needs are planning your day for you. You're having to just care for the people who need it immediately, and hope that there's other nurses around who are able to help out when people, multiple people need things at the same time. But yeah, you're not planning. You're just going and doing the best you can.
Wow. Did your patient load increase then? I mean, is this, so you said normally you have 3 to 4 or 5 patients. I mean, I'm assuming with COVID, it was a lot more?
Right. So it was definitely different because the facility that I was at was, they had so many ICUs that they had to open in order to care for all these patients. And so I was on a different unit that wasn't typically an ICU. But I would have usually in the beginning when it was the worst. It was like 3 to 4 ICU level patients. Sometimes there was nurses who were able to kind of help you, but they were not ICU nurses. So they're doing the best that they can to help you, but yeah, you're having a lot more to worry about every day.
Goodness. And are you still working these 12-hour shifts during that time?
Yeah, and I actually, when I went there, I was doing 4 days a week.
Oh, wow.
Yeah, they were really in need, so it was awesome to be able to help them out.
Yeah, oh, that's incredible. Amy, let me ask you this before we go to break. You talked about, you said it was completely different going from before COVID-19 to where we are now. Are you seeing a light at the end of the tunnel with regard to the virus? Are things, from where you are and the patients that you've been working with, do you see hope in any of this coming out? Or is this something where, is there a warning here that says, no, this is going to, we think this is going to be in for the long haul?
Oh, I wish I could know if it was going to be it for the long haul. I can't. I would love to know what's going to happen in the future, but what I'm seeing right now is that there are way less cases at the hospital both hospitals, I guess, that I'm at. Way less cases. I actually, in fact, haven't worked with a COVID patient in the last 6 of my shifts. So, hopefully things are getting back to normal. As far as if they're going to stay that way, I wish I knew the answer. I really do.
Sure, I think we all wish that. But yeah, that is good news. So, Amy, thank you. Don't go away. We'll be right back. Welcome back to Face the Issues. Amy, thank you again for taking the time to talk to us. And I want to continue our conversation on COVID-19, but specifically move to your involvement with the medical field with it. And so, as some background for our viewers, a while back I put up a social media video asking our viewers to send in stories of hope that they had from people, and we did an episode recently called Stories of Hope, and then one of my friends actually sent me a DM and said, hey, you have to have Amy Shanahan on your show, and here you are. Amy, the story that he tells is a story of a nurse who is working here in the Lehigh Valley, and to your point, you're doing 3 days a week, 12-hour shifts, tiring shifts, and then you decide to go and sign up to volunteer at a hospital in New Jersey, in Hackensack, New Jersey. Talk to me about that. Where did you go? What did you do during that time?
Yeah, so I had the opportunity. I saw it come across, and I've always, you see the different crisis situations that were happening, like in Texas and New Orleans. And I thought that would be, before I was a nurse, I thought that would be so cool to go and help when people are in such need. So I saw the opportunity, and I did the best I could. And I actually was able to take a leave of absence here because there weren't cases here at that time. And I just decided to apply and get there as fast as I could to help everybody out.
And so you went over to it's the Hackensack Medical Center in New Jersey.
Yes.
And let me ask you this: you talked about hearing of these stories before, where there are crises, and people go and they help. What drove you to make that decision? I mean, I certainly understand there's a factor where we see these stories and we think, oh, that's great that there are people who do this. But this is a time where everybody is afraid of the virus. Everybody's trying to run away from it. What drives you to say, I'm going to go to the epicenter of it? In New Jersey, as you know, having so many more cases than we did here in Pennsylvania. What drives that decision?
Man, I don't know what it is. I think what I do know is that the way that I like to be a nurse is I love critical care. I love when people are sick and they need you right here, right now. And just knowing that that's what was going to be happening, and it was going to be a crisis. And it's kind of like the adrenaline, I think, that was like, I can go and help them. And it would be, it's an adrenaline rush for me, and I know it's helpful, which it kind of plays into two things that are very important to me. One thing I love about being a nurse is that in those crisis situations, when things are really going wrong and going crazy, everyone works together and everyone works as a team. And That's something that I was like, all these things kind of seem to line up perfectly and feel like something that I would love to be a part of.
And you got to do it. So you went for, it was, I believe, an 8-week stint first.
Right.
And then you decided to re-up for another 6-week stint, and you're in the middle of that right now. Let me ask you this: now, are you back working at your regular job as well?
I am. So I'm part-time at my other hospital, and I'm doing the 3 days there at Hackensack, and then I'm back at my other job 2 days a week. So for just a short overlap of time, I'm back doing both jobs.
And doing 5 days a week with these 12-hour shifts. Let me ask you about the work in Hackensack, Amy. Obviously, like we said earlier, the cases in New Jersey were a lot more, and you had mentioned that it was very different dealing with the COVID pandemic than it had been previous to it. What were some of the things that you were seeing, and are there stories that, obviously without violating HIPAA, are there stories, are there experiences that you take away from this experience that have impacted you or that you think could impact the community?
Oh man, so it's funny because during it, everyone kept asking me, "How are you doing? How are you doing?" And when it was the worst of it, and it was like, "I'm doing okay. I'm doing good," because you're going there and you're not thinking about anything besides like, I have patients that I need to keep alive. I need to do the best thing that I can for these patients. And then now that it's settling down and I have some more time to reflect, I'm like, oh my gosh, like what is this? Like, what is this pandemic? It's like so crazy. And to think of like all the things that went on, and I kind of got a little sidetracked with what your exact question was, but I think that really it's just like I'm having like a realization of like what just happened, and so it's like opening up a whole new thing for me, I think, as far as that goes.
So I think this for everyone else who kind of was going through that was happening stage 2-3 months ago. You were in the thick of it, so it's just now kind of dawning as you get to look back on it. That's incredible. I had a similar experience in the sense that I was I was COVID positive. I was at LVHN.
Oh, no.
And and I'm good now. I think, as our viewers know, for those who are still asking, I'm good. I'm recovered. But I remember reading about everything happening in the world: the masks, the social distancing, stores or restaurants shutting down, working from home. And then when I finally got out of isolation and actually went grocery shopping for the first time, it felt like I had woken up in a different era. And like you're walking in, and just for the first time, it actually hit me. And so I do, to some degree, understand that sense of which just now everything begins to process. But Amy, let me ask you this: from what you saw, like how are patients being impacted? How was it for healthcare workers? I know the time was crazy, but we're also hearing a lot about just the difficulty it was to be a healthcare worker in that environment. How was it for you doing that as a healthcare worker on the front line?
For me, in the beginning, like I said, it was great to be able to work with people. We all had the same goal. The nurses at Hackensack were so grateful for us to come and be there. And so that was amazing to just know that you're a part of something, and these people are so happy that you're there. So really, we made the best of the situation and had as best of a time as we could to try to work together and do what we had to do. And now, it's been hard for me now to rest. As like everything is settling down, I'm still kind of like feeling like the adrenaline a little bit, and it's been a little bit hard for me to kind of like calm down. And interestingly enough, I was talking to one of the nurses that also worked with COVID patients, and she was saying that it's very common amongst healthcare workers right now to be feeling that feeling of unease and you just can't relax almost, and some people are having trouble sleeping. And really, I just think it's like this is the time now for healthcare workers, as it's starting to slow down in some areas, that we're really like having to make sure that we're keeping our mental health in check and that we're, taking care of ourselves now.
And I think that's so important. We forget that the people who are fighting this for us on the front lines are also people and
Yeah.
need their breaks. And what for you? What does that look like? I mean, what does it look like to take a break? What is it? How do you keep yourself healthy? How do you keep yourself mentally healthy throughout something like this?
I like to do my best that I can to exercise and do some type of a workout, get my heart rate going a little bit as often as I can.
Hmm.
And I'm the kind of person that just needs to talk. I need to talk to people. So I have like an excellent support system. The hospitals have had some people who will like walk around and ask you like if you need anything, if you need to talk. But really, it's just to me, it's just a matter of like reflecting and making sure that I'm aware of the fact that I'm feeling, I'm feeling a lot. It's crazy.
Yeah. And in that mindset, I mean, was there any point in these last, I mean, you still have a few weeks there left, I believe, right?
Mm-hmm.
Was there any point in the last 10, 12 weeks where you thought, no, this is too much, that I'm going to quit, I'm just going back to the Lehigh Valley and just do my regular job? And if so, what kept you going?
That's just that part's on my personality. I don't like to be a quitter. I like to push through and stuff. But yeah, I mean, there's definitely been times that I'm like, I just don't know how much more like I can handle. And I think it's just what gets me through is the reason that I became a nurse in the first place is because it's not about me. It's about the patients, about their families, and now that everything's settling down in COVID world and I'm kind of back to normal. I think another thing is that I didn't really get to talk to families very often. They were kind of talking to like the docs, and now I'm back being able to talk to patients and their families, and that definitely helps me through when you can like interact with people and see their appreciation and know that people are going through so many things, and so to be able to talk to a whole bunch of different people has definitely helped me too.
That's a good point. Last question before we go to the break. I know you're wrapping your time up at Hackensack. How much are you going to miss it there?
I'll definitely miss it. It was fun to get to know people. And again, like I said, people are so appreciative. It's been a really cool experience to be able to travel and see a whole different healthcare system and work with new people. And, I'm bouncing all over the place, learning so much. So I'll definitely miss it. I've always valued the experience.
Yeah. Well, Amy, thank you for what you do. We can't say that enough. You're truly one of our healthcare heroes. And so on behalf of me and other COVID patients, but I think everyone in our community, we just want to say thank you. Don't go away. We'll be right back. Welcome back to Face the Issues. Amy, again, just thank you for your time, but more than that, thank you for what you do and for the way you've served so well during this crisis. I think it's worth repeating. I know it's your story, and for you, this is just something you do, but I think it's worth repeating that in a time where everybody is panicked and trying to avoid the virus, there are people like you who run, headfirst into a pandemic to serve their community, and that's worth so much. So thank you for what you do, for who you are. I want to close by asking your advice for others in the community. And two questions. The first, how can people in the community repay or thank our healthcare workers like yourself?
Oh man, I don't need to be thanked or repaid. Everyone's done so much and like been so supportive. I can't say it enough. But yeah, it's not something that needs repayment. It doesn't.
And I think that's said like a true healthcare hero. And certainly it's we appreciate the work that you and your colleagues do day in and day out. And I think the pandemic is a good reminder of that for us, of that and of the people in our community who do that. The other question I want to ask, Amy, is what drove you to do what you did? Obviously, we talked about that, but what advice would you give to others who are either looking to be more involved and to serve their community, or those who might kind of just be sitting on the couch and saying, well, I'm not sure I want to get my hands dirty, especially during a pandemic? What do you tell other people about what the things that you do, just getting involved in the community and serving?
I think that you got to find what is important to you and what matters to you. I like to encourage people to step outside their comfort zone, but only to some degree. So, don't go and be a nurse if that's not up your alley. But just to like be supportive of each other, find what's important to you, and just take action. Anything that you can do for anyone, it means something. And people want to hear what other people have to say. So I think that whatever speaks to you, follow it, because it's definitely worth it.
I think that's great advice, and it's so important, I think, for us to find our passions and within those things to help those around us. And also, that, certainly not everyone was put on this planet to be in the medical field, and so I take that advice as well. If it's not your calling to be a nurse, don't do it. But Amy, again, thank you for who you are, for all that you do, and for joining us. We really appreciate it. I think on behalf of a grateful community, on behalf of all of us, we just want to say thank you.
Well, thank you so much for having me.
Absolutely, it's our pleasure. That is all the time we have tonight. My thanks to Amy Shanahan and to all of our healthcare heroes around the state, around the country. Thank you for who you are. Thank you for what you do. Join us again next week as we unpack another issue. And until then, you can continue this conversation online. Just remember to use the hashtag #FaceTheIssues. My name is Sam Chen. On behalf of all of us here at Face the Issues, thank you and good night.